The next several videos are brought to you by Knee Rehab Pros and KneeFit5.com. They're going to be dealing with ACL tears. So people hear a lot about ACL tears, and remember from our knee anatomy that the ACL runs from the front here on the tibia to the back side here on the femur. So what happens with an ACL tear, 70% of the time or so they're non-contact, meaning they just happen after a weird landing. So an athlete or a person jumps up, when they land, their knee is not ready for the landing yet and the muscles fire in an awkward position. That puts a twisting moment on the knee like this, and when that twisting happens, it usually goes like this and like this. When that happens, that ruptures your ACL. Now an ACL tear, like I said, about 70% of the time are non-contact, meaning it's just the person landing funny. Sometimes it does happen from contact from the side, usually they're bent and they get hit, and it's a similar thing where their knee opens up like that. There's also a twisting mechanism involved like that, and then the ACL tears. So what happens after you tear your ACL? So we talked about the mechanism, how it happens. So right afterwards, because there's blood supply in the ACL, that usually means that the knee fills with blood. So you get a hemarthrosis. And what does a patient say? Is their knee is swollen. So their knee gets swollen. Most times patients feel a pop. So when they land funny and they tear their ACL, they hear a pop. They usually fall to the ground. They usually cannot keep continuing with the activity that they were doing. And again, their knee swells because of the bleeding into the knee. They have a hard time straightening their knee because of the swelling in their knee. So they have soreness, and they usually present with a limp because of that. So how do I know as a surgeon if someone tore their ACL? Well, first they come in with the history: awkward landing, pop, swelling, stiffness, can't walk good on it, couldn't continue with their activity. And then I do an exam on them. So I do something called a Lockman exam. So normally when you pull the tibia forward like this, the ACL acts to stop. So I can only pull so far. Then when I pull on the ACL torn knee, all of a sudden that stop isn't there, so I can pull the tibia out a lot farther. That, as well as the history, is a pretty good indication that they have an ACL tear. Sometimes people will order an MRI scan to confirm this, although it's not necessary and it can be diagnosed just on history and exam. If you liked this video and found it informative and would like to have further information, please check out our YouTube channel, as we have many informative videos there. Please also subscribe to our video channel and you'll get weekly updates with new information.